My name is Mike Isles and I'm the Executive Director for the Alliance for Safe Online Pharmacy in the EU, or ASOP EU. We work in close conjunction with the Alliance for Safe Online Pharmacies organisation, ASOP Global, based in Washington DC, to create initiatives to make the internet a safe place to purchase medicines for patients and caregivers worldwide. So why do we do this? Well, to put it bluntly, there are over 35,000 websites worldwide selling medicines at any time, but the startling fact is that 96%, yes 96% of them are operating illegally. The ability of sellers to hide their identity and misrepresent their products is particularly attractive to counterfeiters, and so it provides criminals with a very easy point of entry into all countries in the world. These criminals are placing profits ahead of patient safety each and every time, with reckless disregard for the consequences. And we should remember that it is not just the internet websites. Criminals sell their illicit medicines via social media channels too. So it's a growing and difficult problem, the extent of which is comprehensively recorded in the new OECD EUIPO report that was launched today. It makes for astonishing and, quite frankly, very alarming reading. My talk now will be confined to the part of the report that covers the internet. Have no doubts, the internet provides a lucrative and highly profitable channel for criminals. Indeed, it has been estimated that selling falsified medicines online is 20,000 times more profitable than selling narcotics on the street. Global illicit drug sales remain the most lucrative component of worldwide illicit trade, surpassing arms dealing and human trafficking. And this profit comes often without the punitive consequences otherwise associated with selling illicit drugs on the street. For a consumer and patient perspective, it is important to understand the fact that demand is fueling the supply of illicit medicines. It is, after all, you and I that are going online to buy these medicines. Most importantly, however, is the fact that many people who are buying online are simply not aware of the risks associated with illegal online pharmacies. In fact, research carried out by ASOP Global revealed that only 5% of respondents were familiar with available internet resources to identify safe online pharmacies, while 1/3 had actually purchased prescription drugs for themselves or someone under their care. But even more alarming is that a majority of respondents have or would purchase medicines even with the data that we have that indicates there is little awareness of the risks involved. Similarly, ASOP EU research revealed that depending on the country, and this research covered 5 major European countries, up to 85% of the population had in fact bought a medicine online. But when asked if they knew that 96% operated illegally, then again, depending on the country, up to 65% were simply not aware of this. And let's here and now kill the myth that it is only lifestyle drugs that are bought online. That is not the case at all. Looking at 2,300 respondents' replies from the survey as to what medicines they wanted to buy, then it is quite clear all types of medicine are being bought. So we're talking about antibiotics, which in fact is very concerning when linked to the rise of antimicrobial resistance, anti-cancer treatments, blood pressure lowering medication, to name just 3. So it is clear that all of medicines are being bought online. All types of medicines are in fact being bought online, and mostly without the need of a prescription. So what are the health consequences and impact on the millions of individuals who are buying medicines online? The WHO in 2017 characterised these and stated that adverse events due to incorrect ingredients gave rise to a failure to cure or prevent future disease, thereby increasing mortality, morbidity and the prevalence of disease, the progression of antimicrobial resistance and drug-resistant infections, a loss of confidence in healthcare professionals, health programs and health systems, and increasing health system spending on healthcare, and lost income and productivity due to prolonged illness or death. So how can we combat this criminality? Well, for sure, one of the main avenues has to be raising awareness so the unwitting public better understands about the dangers of buying medicines that will be substandard and in many respects can do real harm. In Europe, the Falsified Medicines Directive of the European Union requires every prescription pack to be uniquely serialised with a barcode. At point of dispensing, the pharmacist then checks the pack to be authentic. The pack also has a tamper evidence seal. So this is important, and this directive greatly enhances the security and integrity of the legitimate supply chain. In addition, the directive obliges every member state in the European Union to sell medicines at a distance, and the retailer, in most cases pharmacy shops, have simply to register with their national health authority. And if they are selling medicines via the internet, then each page of their website must display a logo which is described as the common logo, which when clicked on routes through to a page that shows it has been registered. Now each member state is obliged to inform the public of the purpose of this common logo and to explain what a falsified medicine exactly is. ASOP EU has held a number of meetings with member states to share the various advertising campaigns, but it soon became clear that many member states are not carrying out public-facing information campaigns. And so we would urge governments to address this issue and create campaigns to raise awareness. However, there is no silver bullet to solve this problem. It requires all the actors to play their part, and so it requires many, many silver bullets and coordination amongst a myriad of public and private sector partners. Let's quickly review those and who can help solve the problem. One worldwide initiative is the liaison between the Youth Internet Governance Forum, or Youth IGF, and ASOP. This is where young appointed ambassadors with real digital savvy and who are young leaders in 34 countries now have on their agenda falsified medicines. With full support from our supporters, they can be given modest funds to hold meetings and awareness-raising events in their country to educate their young followers and communities, and with their powerful social media reach can begin to educate and spread the word about falsified medicines to their youth networks. Turning to the internet ecosystem, we should start with the Internet Corporation for Assigned Names and Numbers, or ICANN as it is known. They sit right at the top of the internet machinery, and they govern the top-level domain name registries like .co.uk or .com or .fr or any other top-level domain for that matter. The registries have a responsibility to govern their top-level domain names, like the country codes I have just mentioned. And so this means that the registrars who provide the website addresses and therefore have visibility of the organisations that create the websites, all of these actors can play a vital part in internet governance. And then of course there are the search engines that help consumers navigate to the internet. And we have the e-commerce platforms who must ensure they don't host bad actors. And we have all the social media platforms, of course, who also have and can play a vital part in keeping us safe from illicit medicines. So you can see it as a complex problem to solve, And I've not mentioned all of the good work that goes on by the regulators and law enforcers to apprehend the criminals. But I want to come back to one important silver bullet, and it is the use of top-level domain names to provide a safe and reputable resource for the patient on the internet. In the US, the National Association of Boards of Pharmacy, a non-profit organisation comprised of state regulators in the US, Canada and the Bahamas, has acquired the top-level domain name .pharmacy from ICANN. The .pharmacy Verified Websites Programme is an international system that verifies websites operating in the United States, Canada, South Africa, Spain, the United Kingdom, Australia, Ireland and other countries, and it aims to protect online consumers. So pharmacies and other healthcare related service providers and resources wanting to offer the protection and gain the credibility of using a verified top-level domain name like .pharmacy have to pass stringent regulatory criteria. But the important point is, if a visitor searches on the web and finds a .pharmacy website, they can be assured it is genuine and that it is selling medicines in accordance with the in-country laws and pharmacy practice standards. So my plea here is to ask governments and their health authorities to look seriously at similar solutions, such as acquiring a top-level domain name for their country. So for Germany, for instance, the top-level domain name suffix could be apotheker, and for France, .pharmacie, and for Poland, apteker, and so on. But I want to end on something that really brings home the message and shows what level these criminals will stoop to, and it concerns the coronavirus, or to be more precise, COVID-19. The head of the US Food and Drug Administration Commissioner, Dr. Stephen Hahn, recently urged all Americans not to fall victim to false and predatory promises and misguided advertisements around potential treatments or cures for COVID-19. He explicitly said that the FDA will be actively reviewing online pharmacies, retail stores and social media for unscrupulous actors who are marketing unlawful products related to this outbreak. In conclusion, I commend highly this OECD and EUIPO report. It brings together all of the important elements to analyse the extent of the growing problem, but also highlights the good work that is being done and equally points us in new directions to fix the problem. As I've said, there is no one silver bullet, but indeed many are needed. Thank you.